your foot down, okay? Push against it. Ready? Go. Good strength. Now I'm trying to pull your foot down. Don't let me. So you pulling this way. Good job. Let me do it on this side. So I'm gonna pull it down. Don't let me. And I'm gonna push, and you don't let me push it all the way down. Good. Perfect. So all her strength, as I said, I would rate a 5 in all extremities. She's pretty strong, and there's no issues. Part of the motor assessment also not just tests for strength, but also for coordination. So what we're gonna do is you're gonna place your hands on your lap, and as fast as you can, you're gonna switch them over, okay? Flop them like a fish, okay? Good job. And I'm looking for symmetry. I'm looking at, coordination, and she's doing pretty good. This test is a little bit harder, so I am gonna have you touch the tip of this light with one finger, and then touch your nose, and then touch this light. And I'm gonna move that light around to make it a little harder. Perfect. Use the other finger. Let me see if it's the same. Okay, good. The other test we can do is I'm gonna hold this light still. You're gonna touch it with your finger. Go up over your head, touch it again. Do this a few times, and then you'll do the same thing with your eyes closed. Do it all the way up. And close your eyes. Ah, close enough. Good. Use your other finger. Do it a few times where you kind of look at it and close your eyes. You should kind of closely be at the same spot. Just about. Well, I'll let it count. What else? Oh yeah, the heel to shin test. Remember, you use your heel, put it on the opposite leg up here and put it down. Yeah, up and down, and then the other side, and now you do it with your eyes closed. And again, perfectly fine, no issues. We are assessing the gait, so I'm going to have you walk from here to there, just regular. I want to see how you do. Your arm movement, all that, your leg movement, perfectly fine, no swaying, no tremors, no unsteady gait. Now I'm going to have you walk heel to toe in a straight line. I don't know if we can see that. Well, she's doing good. That is assessing cerebellar and position changes. She's doing good. No issues, no asterisks. Walk on your toes. That lets me know how your plantar strength is. Okay, pretty good. And then walk on your heels. That lets me see how your ankle strength and your dorsiflexion strength is. No issues. And then the other thing we want to do, I guess we do it here so they can see. I don't have my camera right. So we want to do the leg bend. So I'm going to hold you, have one leg and do like a bending down, okay? And then the other one, bending down, perfect. So again, she can do that almost without assistance, but I just want to make sure she's not falling. The Romberg test, come stand up right in front of the camera. So the Romberg test has to do with position sense. You're gonna stand with your feet close together. You can put your hand on the side of you and then close your eyes. And I'm gonna look at her swaying, see if she's gonna be able to maintain her position for 20 to 30 seconds, and I don't see any big movement or swaying. Perfect. So we're gonna look at the pronator drift, which has to do with your hands. Hold your hands in front of you. Now close your eyes, and I'm watching for any deviation on the sides, any drifting of the arms, any movement. And again, it's 20 to 30 seconds. The other thing I want to do is I'm gonna tap down, and she should move her arms back into the first position, and that is perfectly normal. All right, open your eyes. We're good with this one. So you can sit down. We did the cranial nerve, the motor response. We're gonna move on to the sensory responses. Again, we're looking for any sensation deviances, touch, hot and cold, temperature, all of that. And it's not in the face this time, so it's on the extremities. So let me use our cotton swab again. So I'm gonna be touching your arms and legs. You close your eyes and you say now when you can feel it, okay?
No. 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 No.
Perfect. We're gonna do the sharp and dull again. So this is dull, this is sharp. Can you feel the difference? All right, ready?
Dull. Sharp. Sharp. Dull. Dull.
Okay. We're also gonna assess again for temperature deviance. We're gonna do hot and cold.
Hot. Cold. Hot. Cold. Cold.
Okay, perfect. The other one we want to do is again the vibration test with the tuning fork. So I tap my tuning fork. This time I place it on your finger, and you tell me what you feel and when it stops. Ding ding. Okay, and you can feel the vibration. Let me see your toes.
Stop.
And you close your eyes. Let me do the other one. Can you feel it? Stop. Okay. So, the other test is called the proprioception or position sense. And this way, I'm going to test your toe. I'm going to have your toe in my hand, and I'm going to move your toe with my fingers up, down, or to the sides. You have your eyes closed, and you tell me which direction I'm going to, okay? Close your eyes. Ready? Ooh, sorry.
Up. Down. Left. Right.
Okay, let me see the other one. We always want to compare two sides, so.
Up. Down. Right. I mean, left, right.
Okay, good. I want to do a little test called stereognosis, which is a discrimination test. So you're going to have your eyes closed, hold your hands up. I'm going to give you something to your hand, and you're going to tell me what it is. Ready? Close your eyes.
A cotton ball.
Okay. I'm going to test the other side.
A hair clip.
Perfect. Okay. Now, there's a test called graphesthesia. So I'm going to have you hold your hand up, and I'm going to draw a number on the palm of your hand. You're going to have your eyes closed, and you're going to tell me what I drew on there, okay? It's this one.
3. 8.
Perfect. Good job. Now, there is also a test called 2-point discrimination test. So I have a paper clip, and obviously it has two sides. So I'm gonna be touching you either with just 1 point or 2 points at the same time, and you tell me what you feel, if you just feel one or if you feel both of them. And you're gonna do that with your eyes closed. Ready?
2, 2, 2, 2, 1.
Perfect. Good. Let me see. So, test-wise, she did good. She could discriminate. She could feel everything. She could feel the hot and cold. So now what I want to do is assess for your deep tendon reflexes. The scale for the deep tendon reflexes is a little bit different than the strength scale. So 2+ is what we want. That's the norm. If the reflex is hypersensitive, that means there's some clonus present, and we don't want that. That means clonus is an rhythmic movement between flexion and extension. So we want to stay in the 2+ area. So let me see. I don't have a reflex hammer, so we're pretending this is my hammer. Again, we're gonna assess your bicep reflex first, which I am gonna grab your bicep muscle. I am gonna tap up here, and it should be jumping there. Perfect. The tricep muscle, I'm gonna have your arm flexed a little bit, like so. Perfect. And then I am gonna push. It jumps a little bit. You gotta have it flexed a little more. I mean, yeah, it jumps. We're gonna do the same to the supinator or brachioradial. Muscle in the forearm, so it's like right here above the wrist, and it jumps there. The next thing, uncross your legs, just have them dangling down, just be relaxed. I'm gonna hit right under the patella here, and it should be jumping. There you go. And then also I'm gonna check back here. The dorsiflexion muscle, I should have it actively jumping a little bit. Perfect. Let me see. Again, there's no hyperactive reflex. Everything is a 2+. What with the reflexes of the extremities, we also assess the reflex of the abdominal muscles. So you can just lean back and let me see your abdomen, your stomach. And I guess I'm just gonna, what am I gonna use? This pen is fine. So lift your shirt up for me, and I'm gonna go from the upper right quadrant down to the umbilicus, same on the other side, and then from the right lower up to the umbilicus. And I should see, I'll let you yawn, I should see the muscle tightening up. Sometimes you can even see the umbilicus moving toward the side of stimulation. So you can see it there. It's moving. and tightening up, and that's exactly what we want. Perfect. You can come in. The other thing I do want to check is your foot. So there is a test called Babinski test. So I want to strike the foot from down here upward. Ready? Yeah. So let me see the other one. Okay, so the foot should go, the toes should go down and not upward and fanning. If it would be upward and fanning, that would suggest some corticospinal lesions, or it could even be stroke. It is normal, I gotta add that, however, in kids, in young kids and toddlers and infants, that reflex is normal to fan those toes out. We can do the straight leg raise to assess for any tenderness in a layback. So if she would not be able to raise her legs and dorsiflex and plantar flex her foot like that without pain, we would have, issues on the spinal cord as well. Let's do this one. And there's no pain, no tenderness. I am watching her face for any grimacing, and there is none. Again, some people are very stiff, especially the elderly. The buttocks and the hamstrings get a little bit stiffer. So we gotta keep that in mind when we assess for that one. But here, everything is fine. You can come up. And that concludes our assessment of the abdomen and the cranial nerves. So thank you so much. I appreciate it. Thank you.